Hello friends, I am Dr. Vijay Prakash and today I'll be speaking to you about dental materials. And the first topic is in dental materials when we talk about is introduction to dental materials. So why there is a need to study dental materials? Dental materials is an essence of practice of dentistry. So any practitioner cannot do or practice dentistry without knowing about materials, because this material science will tell you about the manipulation, the properties, the chemical reactions, advantages, disadvantages about the materials which are used in dentistry. And that is the reason why dental materials, knowing about dental materials is very, very important, because it's a very evolving branch and you have to keep updated with the different latest technology, latest materials which are coming in, and you have to be well versed when we are treating the patient more efficiently and effectively. Now, definition of dental materials. Dental materials is a material science which deals with the development, evolution, care, manipulation, properties, chemical reaction and evaluation of the materials which are used in prevention and treatment of dental diseases. So, what are the categories in which we study dental materials? When we study dental materials, there are majority 4 categories. One is metals, second one is polymers, third is composites. So this is a very broad category, and definitely when we will be studying about dental materials, we will be discussing these in details. And we have ceramics. So when we talk about metals in dentistry, pure metals are used rarely. Like only in cases of direct filling gold, you use pure gold, and in case of titanium, that is pure titanium is hardly used. You use commercially pure titanium in manufacturing of dental implants. So these are 2 categories where metals are used in pure form. Otherwise, in dentistry, most of the time the metals which we used are in the form of alloys. Second categories is polymers. These are large molecular weight materials which are used in fabrication of dentures or auxiliary materials which are used in practice of dentistry. Thirdly, you have composites. These materials which are used in restorations, majority of them. You have glass anamorphic cement, composite restorations for fillings, when we talk about composites. And ceramics, again, these materials are used for replacing teeth with crowns, your fixed partial dentures, ceramic inlay, onlays, etc., etc. So these are the 4 categories in which we study about the dental materials. Next, I'll go very briefly about the historical aspect of dental materials. So when we talk about history, it all started around 4000 BC, wherein your Babylonian culture, civilization, they knew about different types of metals. Then you had in 900 BC, iron was introduced, and then in 100 AD there is a mention of by Celsus wherein lead and tin was used in the filling of the cavities, and so forth. There were a number of discoveries in which you had these metals and ceramics were developed. So next, so there are different mentions about different historical aspects. 1728, Pierre Fauchard wrote a book on dentistry, and he's also considered as father of modern dentistry. And then you had Dr. Greenwood, who actually made dentures for the then US President George Washington with ivory and wood, and so forth. You have number of discoveries after that. You have Philip Pfaff, 1756. We use plaster models in the practice, and then you have different types of dates are there. You have introduction to the cements. You have in 1907 lost spec techniques was introduced by Taggart, and that's a very important discovery. And then in 1840 you have the first dental school which was established in Baltimore, that is the Baltimore College of Dental Surgery in USA. And then in the year 1930 you have the ADA which was established, American Dental Association. And in 1949 Oskar Hagger first introduced bonding with acrylic teeth to the tooth structure, first introduced the bond. Then you have in 1955 you have Michael Bunocore, which introduced the acid etch technique. Now I am touching only the very important occurrences in dentistries which are actually very important. 1956 you had R.L. Bowen, which introduced the bubble resins, which we have the modern day composite resins. Again, a very important discovery. And you had at the same time there was the first generation of bonding agent which was introduced. 1972 CAD/CAM was introduced to dentistry by Marcus Duret Francois. It's a Frenchman. And so on and so forth. You have number of discoveries after that related to the material science, the bonding. So we are not going into detail about that because that will itself take a very long time. So I'll cut short wherein these are some of the very important discoveries which I have just talked about. Now next thing is the ideal requirements. Whenever we talk about materials, we always want a material to behave in a fashion which increases its longevity and increases it helps in function. So basically, what is the essence? Why we require a material? What material you are looking for? So ideal material, yes, it should be biocompatible. First thing, there should be no reaction with the adjacent tissues. It should be non-corrosive. It should be inert material. It should be resistant to tarnish and corrosion. It should have adequate strength to bear the functional forces. It should be dimensionally stable. It should have a very good bond with the adjacent tooth structure. It should be repairable easily. It should be easily available. It should be economical. So these are all the ideal requirements, and there is no material in dentistry which meets all these requirements. So there is still a search for the ideal material. Now next is classification. Now when we talk about classification, dental materials can be classified on the basis of use. So on the basis of use, they can be preventive. Preventive materials are those materials which are used in prevention or progression of inhibition of the dental diseases. Say for example, pit and fissure sealants, they are used as preventive materials. You have second, restorative materials. Restorative materials are those materials which are used in restoration of the tooth. So for example, dental amalgam, composite resins, dental ceramics, all these materials, direct filling gold, these materials all are used for restorations. Third, you have auxiliary materials. Now what are auxiliary materials? Auxiliary materials are those materials which aid in restoration or in treatment of in the oral cavity. Say for example, gypsum products, they are aiding in the practice of dentistry. Acid etch, you have the bonding agents, all these are used as auxiliary materials. Next we have the prosthetic materials. Prosthetic materials are basically which helps in restoration, like fabrication of partial dentures, complete dentures. These are prosthetic materials. You have therapeutic materials. Therapeutic materials are those materials which have medicinal properties. Say for example, a material which is having a slowly releasing fluoride, like in glass ionomer, which inhibit the progression of dental diseases. So these are all the materials based on the uses which are used in dentistry. Next you have on the basis of the chemical structure. Like for example, I told you about the categories of dental materials. You have metals. I have already told you about composites. You have polymers, and you have the ceramics. So these are all the materials. Based on time duration, you have temporary dental materials which are used for a short duration, and you have permanent materials which are used for a longer duration. So these are all the types of materials or the classification of dental materials. Next we have what are the challenges when we talk the restorative materials. What are the challenges when we are talking about restorative materials? Now the challenges here are many. When we talk about a material which is used in the patient's mouth, you have first we need to understand what are the variables. First of all, you know that the outer portion is the tooth enamel. So you have the enamel, inside you have the dentin, and then you have the pulp. So when we are doing a restoration, suppose there is a cavity, you have cleaned it, and then you are doing a filling with this kind of a material. Now this cavity which you see, or the restoration, is not only including the enamel, tooth enamel, but also tooth dentin. So the properties of tooth enamel and tooth dentin are different. Both are different variables. So you have to have a material which bonds to both the enamel and the dentin, and it functions for a longer period of time. Now where does failure occur? Failure usually occur at this interface, the interface between the tooth structure and the restorative material. So there usually the failure occurs. So you have to have a material which stays there for a longer period of time. You are not doing a restoration just to last for say a few months or a day or so. You have to have a material or you have to have a restoration which lasts for years. The patient remembers you, and you have to have a longevity. You have to check the longevity. So the challenges with the materials which we used in the oral cavities are number one, the interface. You have to have a good bond between the tooth structure and the restorative material. You have to have a material which is compatible with both dentin and enamel. You have to have a material which matches the properties of enamel and dentin. It should be similar. And you have to have a material which is definitely meets the ideal requirements. That is, they have to be biocompatible, and also you need to check when the patient is biting. It needs to bear the masticative forces. So it has to have a good strength. It has to be dimensionally stable. It cannot remove, or it cannot fracture, and it cannot chip off in function. So you have to have a good strength. Also you have, because in an oral environment when the patient is biting or functioning, there is cyclic loading. That is, cyclic loading means once the patient bites, second time, third time, and over a period of time. So this is cyclic loading. There is continuous loading of that material. The material should be able to bear this cyclic loading. So another variable here is you have to have a good strength of the material. Also, it should not deteriorate in the oral environment which is having saliva, or whatever the patient is consuming, whatever the patient is eating, it should not deteriorate into that. So all these are challenges which are there when we talk about restoration in about the restorative materials in dentistry. Next is evaluation. Evaluation of dental materials. This is another important thing when we talk about evaluation of dental material. In 1919, US Army approached the National Bureau of Standards and they asked for the specification of dental amalgam. They asked the National Bureau of Standards that what is the specification for dental amalgam. So now National Bureau of Standards was not aware, or they did not make any list about any kind of specifications. So prior to that, however any patient and any doctor was practicing and mixing and placing dental amalgam was not specified or standardized. So there was a need for standardization. So American Dental Association, ADA which we call as, was formed in 1928 on the direction of National Bureau of Standards, and they told American Dental Association that you lay down specifications and standardization of different materials which are used in dentistry. So American Dental Association was formed in 1928. In 1930, they formed a certain kind of specifications. Like for example, dental amalgam is ADA specification number 1. Now this specification will tell you about how to manipulate, what are the properties, what are the composition, what should be the strength after the use of this material over a period of time, and it should not deteriorate, it should not be toxic, the mercury which you are using should not be toxic. So there is a proper specification in which you have to use this material in the patient's mouth. So this way different other materials were identified, and it was prepared in 1974 ADA specification. They prepared 1994. They prepared a list about all the materials which are used in dentistry, and they made a list about the ADA specifications. There was a big list which was having all the materials which are used in dentistry and which the dental practitioner can take it as a guide and then use that and apply that in the practice of dentistry. So ADA specifications, you have different specifications. When we are talking about material, when you are buying material, you have to have a specific what specification under that material comes under, what is its properties, the manipulation, everything which you see whenever you open a packet. You find a leaflet which is there with any material. You just open that and it will give you all the details about the specification of that particular material. So this was an important thing which happened, that is about the dental specifications. And ADA also laid down the ADA seal of acceptance. That is, whenever a new material is formed, it has to clear all those the protocols which ADA is laying down, that it has to meet all that, and then only that material will be allowed to be marketed and to be used in the patient's mouth. So of course you have the ADA specification, and you have another international standards. You have FDI, Federation Dental International, and you have the ISO, International Specification Organization, Standardization Organization. Now, on the behest of FDI, it directed the ISO to form a technical committee, that is TC 106 is for dentistry. So it made a technical committee, because now it handles, because worldwide dental materials are used. So world over you have the ISO specification. Under ISO specification, and that also it has directed to the technical committee TC 106, that is specifically for dentistry. So all the materials in dentistry, and it tells you about this, So I have given in detail in my book, that is the textbook of dental materials. I'll put the reference in my description box. You can check that. So you can go through the different types of materials which come down under this. That is TC 106. You have different headings wherein you have the working groups, WG 1, 2, like this. You are having number of working groups, and according to that they have certain kind of specifications of use of certain kind of materials. Not only this, world over you have different other types of international standards. You have the Australian dental standards, and then you have the NIOM of the Scandinavian countries, and then you have the CEN, that is the European standard of specification for different materials which are used in dentistry. Now what is next is the safety. How safe are the materials which you are using in the oral cavity? That is the safety of the restorative materials. Yes, definitely. When we are talking about any kind of material which is used in oral cavity, that is a foreign material, definitely. And this foreign material, when you are using in a certain dose, it may give kind of an allergic reaction, or it can be toxic. So definitely, if you are following the ADS specifications and you are following the international standards, such kind of things is rare to happen until unless you use that in a larger quantity. Now, according to, I just remember a quote by Celsus, which says that any material can be poisonous if it is used as an overdose. So how do you differentiate between a treatment and the poison? That is, any material can be poisonous if it is used beyond the limit in which it has to be used, and it can be as a treatment option also if used in that specific quantity. So definitely we have to keep in mind about the safety of restorative material, and also the safety in which that material can be used in that particular patient and in that particular oral environment. Next are the future practices. Now this is very interesting. What are the future trends in dentistry? You will be having in future lot of research is going on about regenerative dentistry, and you have materials which will be changing or which will be self repairing on its own. So you have a material which is slightly chipped off, or if there is some kind of marginal gap between the restorative material and a tooth. So the material will be, in future, the material will be having its inbuilt quality, that it is going to go and pack that space, or they are going to repair that space if there is any such kind of problems, or there will be regeneration of particular. So suppose you have removed a tooth and you place stem cells into that area, then there will be regeneration of that particular tooth. So these are some of the future practices which will become a reality in the coming years. And you definitely have kind of 4D printed materials. 4D printed materials are basically you have a time bound material which changes or orients based on the type of stimuli. Say for example, it changes its behavior, the material will change its behavior on a specific temperature or higher temperature, or say the touch sensation, pressure sensation, so it will alter its behavior. So these are different kind of future practices. Definitely I will be talking in detail when I talk about this future practices in dentistry in these subjects in the coming lectures. The future practices in dentistry, definitely you will be studying this, or the research is going on at the molecular and cellular levels. So this can be another very interesting topic for you to search into, that what are the future practices which can happen in dentistry or which are happening. So you can just out of curiosity you can find it out. And also there can be questions like why there is a need to evaluate a material, why there is a need to have specifications in materials, and what are the challenges, as I mentioned to you, what are the challenges of using materials in the industry. So with this note, I will be saying thank you for watching the video, and if you have not subscribed to my channel, please do that. Thank you very much.